Colorado has now vaccinated 1 million people with at least one dose, and the supply will soon get a big boost.
It will arrive just in time for the next group of eligible Coloradans. The Department of Health today announced it will receive 218,000 doses in early March. The state has the facilities and the people in place to vaccinate up to 350,000 people weekly. Knowing this dosage increase is coming in, there are plans for mass vaccination sites. They will be run by the state and FEMA. More details will be coming in the days ahead. Under the current phase, people 65 and older, along with education workers, can get the shot. The next phase will bring in a lot more people starting March 5th. That's most essential workers, regardless of age, plus people with 2 or more health conditions. Tori Mason has been looking into this expansion for us. And Tori, a lot of excitement over this next phase and a lot of planning, too.
Definitely. CDPHE says they're actively planning for the next vaccine phase 1B.3. Frontline workers are just a couple weeks away, and as we know, restaurants have been hit hardest by COVID-19. But when it comes to vaccinations, they're finally being seen as essential.
We weren't even listed restaurant workers.
Food service workers aren't explicitly named under Phase 1B3 in the state's vaccination chart, but CDPHE says they're essential too.
We walk up to a table and there are patrons that are unmasked.
Chris Fuselier, owner of Blake Street Tavern, lost nearly 30 employees who said the risk wasn't worth it.
I do have diabetes, and I'm trying to be as careful as possible because I am, suspect to being vulnerable. I've got other staff that have severe allergies, asthma.
CDPHE says vaccine providers have the capacity to vaccinate between 300 and 350,000 people per week.
The first part of March, we're actually increasing to 218,000 doses.
It's the same week essential workers become eligible. CDPHE estimates there are nearly 1.2 million Coloradans who qualify.
We are currently planning other avenues, including large mass vaccination sites around the state.
Coloradans in Phase 1B3 have a lot in common. They all provide essential services, and most aren't paid enough to risk their lives to provide them.
Our staffs are working paycheck to paycheck, and they need to be at work.
Now, the owner says he is very grateful that he and his employees are considered essential and that they're able to get that vaccine, but he would love some more guidance from the state so he could share with his employees information on how and where to get those vaccines. Their time is just right around the corner. We're live in Denver. Tori Mason covering Colorado First.